Hello there, my name is Dr. Faraj Edher, and welcome to my informative webinar talking about smile makeovers. Now, the reason I'm conducting these webinars is I truly believe that information is power, and I believe that you deserve all of the information that you can get in order to make the best possible decisions related to your oral health and your smile. This webinar is going to run for around 20 to 25 minutes, and it'll focus on all of the different options involved in enhancing a smile. We'll talk about things like whitening and veneers and direct bonding and crowns. We'll discuss the differences between these options and what the benefits and risks are of the different things that can be done during a smile makeover. Now, before we get started, I'll introduce myself. Like I said, my name is Dr. Faraj Edher, and I'm a dental specialist in prosthodontics. So what that means is I spent 3 additional years after dental school getting some more extensive advanced training related to prosthetic dentistry, which includes restorative dentistry, cosmetic dentistry, things like crowns and veneers and implants and bridges and dentures, all of the restorative things that we utilize to give people back their healthy, beautiful smiles. I'm also the director of the Digital Dentistry Institute. That's a global educational institute where we teach hundreds of dentists around the world how to better treat their patients utilizing the most advanced dental technology there is. I teach part-time at the University of British Columbia, where I'm a guest lecturer and a clinical assistant professor, and I'm also a fellow of the Royal College of Dental Surgeons of Canada. Now, I practice in Vancouver and Coquitlam and Prince George, British Columbia. What you see on this photo here is our office in Vancouver called BC Perio. We have an amazing, beautiful view of Vancouver, especially on a nice day like this one. But what's really special about our office is we utilize some of the most advanced digital technology out there. Whether that's intraoral scanning, being able to take cone beam CTs, we have an in-house lab so we can control the quality of all the work that we do, and we utilize things like smile design in order to communicate better with everyone involved, to provide very efficient and predictable and high-quality dentistry. Now, before we get started, let me say that this webinar will discuss some of the general information and the most common questions that I hear from my patients on a day-to-day basis. It's not intended to be unique medical or dental advice, because you still need to come in and see me or your dentist for an examination and a consultation so we can determine what the right dental treatment is for you. Now, that being said, we're going to talk about smile makeovers. And smile makeovers are really anything that is done to enhance a smile. If you're not happy with how your teeth look or how your smile looks on a day-to-day basis, we're going to talk about what the different options are to improve this. Now, the simplest option is professional whitening or bleaching, and this is something that we do in our office. We have a light activated whitening system, and whitening is a good solution for some people, and we'll talk about that a little more. So the reason it's a good option is it's a less expensive option compared to other things that can be done, and it's also faster. It can be done in one session that usually takes anywhere between half an hour to an hour. It's a good option only if you are happy with the overall shape and size of your teeth. And the thing that you really want improved is that you wish your teeth were a few shades brighter or lighter. So that can sometimes, or a lot of times, be achieved with whitening your teeth. What you have to be aware of, though, is that whitening does not help if you have old restorations that are discolored, or if you have crowns or deep intrinsic stains in your teeth. This here is an example of one of my patients who came in, and these are the before and after photos from whitening. So as you can see, she was unhappy that they looked a little yellow and dark, and we were able through whitening to whiten her teeth, and she was really happy with the ultimate results because, as I mentioned, she was pretty content with the overall shape and position of her existing teeth. Now, what about bonding? So a lot of times people come in and say, we've heard of bonding, and bonding can be used to give us back a beautiful smile. And this is something you have to be very careful about. Bonding is when we use filling material and we add it to the tooth in order to change the color or the shape or to rebuild part of the teeth. And this is a great option because it's less expensive and can usually be done in one appointment. But it's only useful, in my opinion, for minor adjustments. So this is what you see on the photo here. We have 2 front teeth that have been chipped and broken. This patient accidentally bit into a fork. Because these are considered to be minor adjustments and repairs to the teeth, we can get some beautiful results using just bonding. That being said, the reason I'm not the biggest fan of bonding when people come in wanting a smile makeover is because bonding is a weaker material compared to ceramics and other things that we utilize, which means that it's more likely to break. It's also more likely to stain over time, and it's more likely to wear. So here's another example. What if you're in a situation similar to this gentleman who came in to see me, where he's very unhappy with his overall smile? His teeth are discolored, he has old fillings that he doesn't like, and he just doesn't like his smile. Now this is an example of a case where I wouldn't recommend bonding, because bonding to this extent for a smile makeover is a short-term solution in my opinion. It is not something that he'd be happy with in a few months or a few years. So for a case like this, how are we able to go from this to something like this, where you can see we've made quite a difference, and he was very happy with the final outcomes, where we have a beautiful smile now, and we've addressed a lot of issues and a lot of concerns in a very efficient and a very short period of time. So this is an example where we utilized crowns. So I'll explain to you what crowns are if you're not familiar with them. Your tooth, if it's discolored or broken down or worn down, can be shaved down ever so slightly, and by ever so slightly I mean approximately 1 millimeter. We make room for a crown to sit on top of that tooth and allows us to recreate the color and the shape and the function sometimes of that tooth. Now, the advantages of crowns are that they protect the entire tooth, which is needed in a lot of cases if that tooth has had a root canal. It can also be used for teeth that have severe discoloration that needs to be covered up, and it's very useful for building up severely worn down teeth. So it's a good option if you grind your teeth. When done well and maintained well, we know that crowns can last 15 years or more as long as they're maintained well. Now, the major disadvantage of crowns is that we need to shave down the tooth, like I mentioned, which means that we have to give you local anesthetic, and it's not a big deal. It's something that I do on a daily basis, but if we can preserve your tooth structure, then that is always the better way to go. So that takes me to the other option, which is veneers. Veneers are very commonly done when the main purpose of the treatment is to enhance the aesthetics of your smile, which means that the teeth aren't necessarily worn down significantly. The teeth might be discolored, they might have some cracks or wear on them, but it's nothing too extensive. So what that allows us to do is only roughen or remove a very small portion of your tooth. We're talking about something as thin as a contact lens in some cases, and we create this veneer that sits on the front side of your tooth that allows us to improve several things. So these diagrams kind of show what that means. You can see here the veneer sits on just the front surface of the tooth, which allows us to be very conservative in the amount of tooth structure that we're having to do any work on. So in other words, you get to keep most of your tooth, but at the same time we're able to utilize the veneers to give you a beautiful smile. Now let's take a look at this as an example. This young lady came to see me. She was very unhappy with the look of her two front teeth. You can see she's had veneers that were done some while ago. They're discolored, they don't look very good. She was just never happy with the results. So when she came to see me, what I do for all of these cases is I do something called a virtual smile design. I feel like it's very important for my patients to never feel uncertain. So I take a photo and then we can use technology to start to plan together what we want the final outcome to be. So in this case, we were discussing lengthening the teeth slightly, closing that gap in the middle there, and we're able to, this is all done on computers, so nothing's been done in the mouth so far. This just kind of gives us an idea of what we want the outcome to look like. So we're able to finally give her these two veneers that look quite beautiful, natural, and they blend in nicely with the rest of her teeth. She was very pleased with the outcomes. So the advantages of veneers are that we have to shave down much less, or sometimes we don't have to do any preparation on your teeth at all. They don't cover the entire tooth, they only cover the front aspect of the tooth, which leaves you with more of your natural tooth structure. When we're doing very minimal or no tooth reduction, this can sometimes be done without the need for any local anesthetics, so no needles or freezing involved. And we're able to utilize veneers to correct the shape, color, and the alignment of your teeth. And just like crowns, we know that if veneers are done very well and maintained well, they can last for 15 years or more. Now, the disadvantage of veneers is that they really truly have to be done very well so that they fit very precisely to your tooth and your gums to avoid complications. One of the common misconceptions about veneers is, they cause bad breath or they lead to the gums being inflamed, and that is not true if the veneers are done very well. Where they do cause bad breath or inflammation of your gums is when the veneers are not fitting or adapted accurately to the tooth and the gums, which leads to food getting stuck under them, and that can lead to the bad odors or the bad smell in your mouth, and can also lead to the inflammation. But when veneers are done well and they're planned properly, they can do very well, and they look very natural, they feel very natural, and they don't lead to any sort of negative effects on the overall gum health or on the health of your teeth. The other thing about veneers is because they're so thin, they can't be used to correct teeth that are too crowded or that are severely discolored. In those cases, it would be better off to go with a crown as opposed to a veneer. Now, the process for veneers is really quite simple. We do the consultation, during which we also do a virtual smile design where we can look at the new smile on a computer screen so that we're able to get very predictable, high-quality results. And then it's usually done in 2 sessions. One session where we prepare the teeth and we give you a set of temporary veneers. And then 2 weeks after that, you come in, we remove the temporary veneers, and we put the final veneers in. So 2 sessions where most of the work is done, and usually those sessions are very comfortable in the sense that you come in, if we're doing tooth preparation, you get the freezing, so there's nothing you feel throughout the procedure, and usually you'll have headphones on, and we have TV screens where that you can watch a movie or watch a show while we get all the work done. So this is another example of a patient that came and saw me. She'd had a lot of work done on her upper teeth that didn't go so well, and you can see it didn't look very good in the before photo on the upper part of the screen. And we were able to use veneers for her to give her back a beautiful, natural looking smile. And the thing about veneers or crowns or any sort of restorations is we have the ability to control how white or how natural we want them to look, and that's a very patient-specific thing, so it depends on what your needs and what your expectations are. So this is again an example of another patient. She had discolored teeth that had been worn down. She was very unhappy with them, and you can see in the lower photo we were able to give her a beautiful smile utilizing veneers. So this is another example here. This patient came to me, she had had veneers placed on her front 6 teeth, and she was very unhappy with them. She was unhappy with the way they looked, but more importantly, if you look at her gums, you can see how there's that red band. That's all inflammation. That's not good. And the reason that's there is because those veneers didn't fit very well. So we take a look at everything, and again, I utilize technology to make sure that everything is planned precisely so we can get the highest quality results possible. So this is all the planning that's done on the computer using technology, where we're able to start to plan what we want the final teeth to look like. We're able to do this planning with the patient's image there, and in 3 dimensions, utilizing technology and all of the computer-aided tools that we have, we're able to really plan for more predictable, high-quality solutions. So for her, we were able to go from this, which are her old veneers that she wasn't happy about, the way they look wasn't good, they look fake, there was gum inflammation, they didn't fit well. We were able to have her leave with something that looks like this, and you can see how much more healthy or how much healthier the gums look. You can see how much more natural the veneers look. It's almost hard to tell that they're veneers. So some things that you should look for if you're thinking of having any sort of work done to enhance or improve your smile. First of all, look for someone who has the right skill sets and experience for the treatment that you're going to go through. In my opinion, attention to details is very important when it comes to aesthetic cases and cosmetic improvements to teeth, because it's the small details that make the difference between good results and excellent results. You also want to have an idea of the technology that's being utilized. In today's world of dentistry, there's so much technology that allows us to really provide our patients with very predictable, high-quality results. I think it's important that your dentist spends the right amount of time with you in the chair, and that's something that I do on a routine basis, is I really listen to my patients, because it's important for me to understand what their expectations are, what their concerns are. Because at the end of the day, what I want to provide them is a smile that they're happy with and they look at in the mirror every day and say, wow, I have a beautiful smile. The quality of the work that's being done is very important, and that's a team effort between the dentist and the lab. The quality of the materials that are being used to make the teeth are very important. And it's important for you to just feel comfortable with the dentist that you're seeing in the clinic that you're going to, and making sure that it's somewhere that you feel comfortable in. Another thing is make sure that there are no hidden fees. And what we do in our office is when someone comes in for a consultation, we provide them with an estimate that includes all the different aspects of the treatment that we plan on doing based on the examination and the diagnosis that we have come up with. So, for the last few minutes of this webinar, I'm going to go over with you the consultation process if you choose to come in and see me for a smile makeover. So you'll schedule your consultation appointment and you'll come in to see us. This is the front desk or reception area. You'll come in for your appointment. This is our office in Vancouver, as I said, and you'll probably meet first one of our dental assistants. This is Courtney, the dental assistant I work with in Vancouver and Coquitlam. So Courtney will sit with you and she'll ask you a few questions to start understanding what it is that you're hoping to achieve. I'll come in and I'll be a part of that conversation too. We'll discuss your expectations, your concerns. I'll explain the different options to you, and we'll do an examination. So I'll check all of your teeth. I'll see exactly what's going on. We may even take a few photographs, because what that allows us to do is do a smile design on the computer where I can show you what your teeth can look like. You can give me your input as to what you like or you don't like, whether you want them longer or whiter or darker. And we're able to look at that together in order to come up with a game plan for how we want the final aesthetic outcome to be. So in that consultation appointment, we'll do an examination, we'll understand your concerns and expectations, we'll discuss all the different options, We'll go over in detail the timelines and the costs associated with the treatment. We'll decide on a treatment plan together, and we'll do a virtual smile design so that we're both on the same page as to what it is that we want to achieve. Now, if you have any questions or any concerns, feel free to reach out to me. You can visit my website, drfarajedher.com, or you'll find me on social media at Dr. Faraj Edher. I always welcome any questions. Like I said, I truly believe that information is power. I think it's important that you have all the information you need in order to make the best decisions for your oral health and your smile. These are the numbers of the offices that I practice at. Feel free to give them a call, ask them for a consultation with Dr. Edher, and you can come in and we can go over everything together and ultimately make sure that we make a difference for you so that you have a smile that you're proud of and a smile that you're happy seeing every single day. Thank you again very much, and feel free to reach out to me if you have any questions or if there's anything that I can clarify for you. Have a good day.